Okay, you are listening to the award-winning Philadelphia Hall Monitor here on WPPM 106.5 in Philadelphia, on Comcast Channel 66, and streaming live at phillycam.org. You can find us on Twitter at Hall Monitor WPPM, on our website www.hallmonitor.org, or on Facebook at PHM Tonight on the program, we'll be joined by Helen Lawhead, the Chief Financial Officer of Philadelphia City Council, to give us a Budget 101 tutor session. Lance Haver will provide an update on community health centers, and Hall Monitor correspondent Allison Beck will join us to discuss her recent work covering Kensington. Now, Denise, this is usually where I'd ask you how you are, but I'm going to tell you how you are, because last week you won an award, Best Independent Journalist here in Philadelphia. Congratulations, and how did that feel?
Well, for one thing, I was really surprised by it because, first of all, I didn't even know I was being nominated in the first place. And then, when I got there, I said, oh, there's no way I'm going to win this, because when you look at some of the people who are independent journalists here in the city, we have a lot of really heavy hitters here. So, when they called my name, I was like, wow, well, thanks, and thank you, Larry, and all the folks who listen here at Hall Monitor, and thank you to Lance, because people who are independent journalists are only as good as what assignments they're given and what kind of trust people place in them. And it made me feel really good that several of the editors that I have worked with over the past year were in the audience. So I was like, wow, I was able to thank them personally for putting me in the position to win this award, but it was nice. And I think the only person happier about it than I was Chris, my husband, who occasionally comes on the show and talks sports with us. He was like, over the moon. And I'm like, it's great to have someone who supports you like that. And especially since, he's an award-winning journalist in his own right. So, that kind of made me feel good.
Well, it is well-deserved. I've said it before. I'll say it till my dying day. You are the best journalist in the city. And Hall Monitor is incredibly lucky that you're here. And this would not have worked without you. So thank you for everything you do.
Thank you.
So now let's get to some of what you do. We spoke with Helen Lawhead, the Chief Financial Officer for Philadelphia City Council, about how the budget works, how it fits together, and what people can expect. So here's our interview with Helen Lawhead. All right. Well, Helen, thank you so much for joining us.
Hi, it's great to be here.
So let's just start with the first question. What is the city budget?
So the city budget is where the city puts its resources, its money, to be able to spend on city services and programs that help keep Philadelphia running and serve Philadelphians.
So there are multiple components that make up the entire city budget. Can we start off by talking a little bit about the operating budget?
Yes, so that's a great point. There are two main types of budgets. There is our operating budget, which funds our day-to-day services. That's things like our trash collection, our payroll, paying for supplies that our city employees need to do their job. And then there is our capital budget, which funds our long-term infrastructure investments. So that's things like our rec centers, some of our larger vehicles. Our capital budget also includes large investments in things like our IT systems. And there is a threshold that we have to keep in mind for our capital budget. And that is, items in our capital budget have to cost more than $15,000 and have to have a useful life of 5 years or more. So we really want to be using our capital budget for things that are used over a longer period of time and cost a larger amount of money. And that is because we actually borrow money for our capital budget. And when we borrow money, we have to pay debt service on that. It's kind of like your own personal, maybe for your personal budgeting, when you put something on a credit card or you have a mortgage for your home, that you have to pay that debt service or that interest on that. And so you really want to reserve that for those larger investments. Where things that you can pay with maybe the cash on hand is where we budget in our operating budget. So again, it's those kind of day-to-day services.
So when we look at the capital budget, that's a very long-term view
Yes.
of city infrastructure, buildings, pipes, you name it. What is it like to sit down and make a decision like that? To say, okay, well, we need this, but we also need this, and we need this, but we can only get two of them. What do we do? Is it in a long-term plan?
Yes, it is. And in my position as the city council CFO, I'm looking at it from the council side, but prior to joining city council this year, I worked in the budget office in the prior mayoral administration. And so I was part of those conversations and those decisions that the mayor has to make when they are making their proposal to city council. And so specifically for the capital budget, as you mentioned, Philadelphia has a lot of need, especially in our infrastructure. We're a really old city. So we have old water mains, we have old rec centers, and so really high levels of need. And not all of that can get funded every year because we only have a smaller pot of money to be able to make those investments. And so what the administration has historically done is they meet with all departments to go through these requests to see what the need is, and then ultimately propose that budget. Other inputs they receive is through some community engagement, some other prioritization. And then in addition, the capital budget and the capital program is approved by the city's planning commission prior to it being proposed by the mayor. So there's another added layer to make sure that what we're proposing in these budgets also aligns with our long-term capital plan as well.
Now, getting back to the operating budget, it seems to, and I'm a layman at this, I like it, I enjoy it, but I'm not a professional. But it seems to me when we talk about the operating budget, it'd be very easy to assume every dollar is already accounted for before we even really sit down. Is that the case? And if so, when we have a new initiative or something new we want to try, how do we kind of make that work?
Yeah, so that is a great point. And it is true that portions of our budget are what we call have fixed cost. And so they are spending that we have committed to in the past that we have to maintain those commitments and use that money towards those. And so a good example of that is our pension obligations. So the money that we have committed to fund our pension fund. Also, as I mentioned before, we have some commitments to our debt service payments. So again, money that we borrowed in the past, we have a commitment to pay back that and pay that service. And so that takes up a portion of our budget. And then we have some other costs, which we like to call inflexible cost. And really what that means is we could make tweaks to that, but it would take a while to do that. It would require us to do that over a phased period of time, or they're inflexible because people really rely on these commitments, and it would be a drastic change to take those away. So a good example of an inflexible cost is our commitment to the school district. It's something that we know we need to do as a city to support our school district. And so changing that contribution would be really difficult to do and have a really big impact. And so really that pot of money that we have up for discussion each year is less than 50% of our operating budget. And so again, most of that is when the mayor uses that to make her proposal and then council goes and reviews that. And so that's what we call the discretionary spending. And again, that's a little less than half of our operating budget.
Mm-hmm. So how does this process begin in the city? Now, the fiscal year begins on July 1st.
Yes.
So that's what we're talking about, the 2025 fiscal year budget. Okay, begins on July 1st. Let's start right after that. Okay, how do you get this ball rolling? Say, is it in August? Is it a little later than that? When does that begin?
So yeah, that's a great question. So July 1st, budget has been passed. City departments get their budgets for that year. They're starting their operations. They're starting to spend their funds. And then starting in September, the budget office traditionally meets with departments to check in with them to say, how is spending going? How are operations going? Because you have to remember, we put together a budget a long time ago, almost a half a year prior. And so that is the time the budget office goes in to check in on departments and their spending and their operation. And then really starting in October is when the budget office begins to plan for the next year's budget. And so you're only a few months into the budget fiscal year, and you're already starting to plan for that next year already. And what happens is the budget office sends out what they call a budget call to departments. And they'll do this for the capital budget, and they'll do it for the operating budget as well. And it's called a budget call because back in the day, the budget director used to call up city departments. Now they have meetings to discuss really what they want to see in their budget next year. What are the needs that their department has? Are there any changes to maybe some of the revenues that are coming in? And so they start to meet with departments throughout the fall, and into January, they'll continue to have those meetings with departments. Then starting in January through February, the budget office is working with an outside economist to put together revenue projections for what they think the revenues are going to bring in for that next year's budget. And so they really have to figure out, how much money do we have to work with? What is our wage tax going to look like for next year? What about our business taxes or our sales tax? So they need to get an idea of how much money they have to spend. And then ultimately, once they know what those revenues are going to look like, once they've started to prioritize and put together a budget that is then incorporated and proposed to City Council in March, the mayor has to submit a budget to Council at least 90 days prior to the end of the fiscal year. And so that has traditionally happened in March. And as you know, we'll be receiving the mayor for her first budget address this week on Thursday, March 14th.
So, it sounds like a lot of the budget is based on projections. What happens if the projections are off by more than a reasonable degree, one way or the other?
Yeah, so throughout the year, there are 2 opportunities to make further tweaks to a budget. And you are right, a government budget is a projection. It is our best guess at what we think our revenues are going to do. It's also our best guess at how we think spending is going to happen. I think, you have probably seen in the last few years, the city has struggled with high rates of staff vacancy. And so when we're putting together our budget, again, it's our best guess of how much we think we're going to be able to get staffed up. But then that does change throughout the year. And so traditionally, there are 2 times during the year that you can do transfer ordinances is the term. And essentially that means that the administration or council can go and make changes to the legislation for that year's budget. And they can change some of the spending, they can move spending around. And really that's to respond to the actual numbers that are coming in during that fiscal year.
All right, I'd like to bring in Denise Clay-Murray here on Philadelphia Hall Monitor.
Yes, thank you for joining us. We really appreciate it.
It's great to be here. Thanks, Denise.
I guess my first question is, in terms of the budget process itself, what part does council play in it initially? Or is what council does completely after the budget is presented?
Yeah, that's a great question. And so first I'll talk to how council works through the budget hearing process. So once the budget is introduced to council, there's about a month and a half of budget hearings. So every department will come before council and testify about what's in their budget and really go through some of the maybe increases or decreases to their budget or major changes that they're proposing to make operationally and what that means for the budget. And so that's a really intensive time for city council where they're able to go through all of the budget materials. You may have seen the budget details that the budget office produces. That's thousands of pages. And so council, their staff, they're really taking that time to dive deep and review the proposed budget. And then, as I mentioned, again, there are periods throughout the fiscal year where there can be transfer ordinances as well to kind of tweak the spending that happens during that year. And that goes through the appropriations committee in council. And then additionally, outside of that, the mayor and the council president really work to make sure that there's a sharing of priorities. So that budget priorities for city council, budget priorities for the mayor, there's open discussion about where those priorities lie.
Okay, now the process, hearings start not too long after the budget is presented. When it comes to council, do they make tweaks in the budget along the way? And if so, I guess what is the working relationship like between your office and say the current mayor's office? How has it been in the past with previous mayors? And just have there been any has there been any fist banging on the table or anything like that?
Great question. So while we go through the budget hearing process, that's the time for council to review that proposal. And ultimately, what ends up happening is council works to make amendments to the proposed legislation, and that ultimately changes the budget proposal to our adopted budget. And that happens through a negotiation process with council and with the mayor's office to make sure that there's alignment there and that what we include in the budget can operationally happen. And so I can speak to a little bit how it's historically happened. As you know, we have a new mayor, a new council president, and so the process may look a little different this year. But historically, it has been a back and forth with the council president's office and with the mayor's office in the finance department to negotiate on some of these items that council wants to make changes to the budget. So that's a little bit of how that has looked in the past for that process.
Now, I remember during the pandemic where it took a while for the budget to get passed because there was a chunk of money that council wanted to go toward anti-violence programs, particularly those that focused on mental health. And there was a chunk that the mayor's office wanted to give for that same purpose. Is there, I guess, if we're looking at this year's budget, is there any kind of a fork in the road that we might need to look at, or is everybody on the same page as of right now?
Well, I can't answer that question yet because we haven't seen the budget proposal since we won't see that until Thursday. And we really want to make sure that council has that time to thoroughly review. And so that answer might change over time as council really has that time to dig in deep into these budget materials. And so I anticipate that to change, and there might be a different answer in the next month or so.
Okay, so you don't get to see the budget before Thursday either?
The council offices are briefed prior to that, but it's a very high-level overview of what's included in the budget and kind of those main priorities. Really getting to see the nitty-gritty details. We don't get to see that until it's introduced to the public on Thursday.
Okay. Well, thank you so much for spending some time with us. We really appreciate it. And I'm going to give you back to Larry McGlynn, our co-host, and you're listening to Hall Monitor on WPPM 106.5.
All right. Thank you, Denise. And Helen, I just have one last thing for you here. When City Council gets the budget, is there going to be a page on the council website that in the past it had been like the 2024 budget center? Is that going to be there this year?
Yes, yeah. So there will be a fiscal year 2025, which is crazy to say. It felt like so far away a few years ago. But yes, there will be a fiscal year 2025 budget center. We'll be sure to share that link out. It'll also be shared on the city council socials so that people are able to access. And on that website, there'll be a ton of information posted for the public to review. That will include testimonies that departments submit to council. It's kind of their high-level overview of what's included in this year's budget. We'll also be posting the budget details, which I mentioned, which are the really the nitty-gritty of each department's budget. And then after the hearings, we'll be posting the recordings of those hearings as well, so that if you want to go back and kind of see what maybe the Parks and Rec department said, you missed that hearing, you can go back and review that as well. And so that'll all be included on that website.
Well, this is the best time of year in city government. It's the most fun. And thank you so much for walking us through it. And hopefully we can have you back on a little later in the process where we can talk maybe a little bit more of the details.
Yes, that would be great. I appreciate it.
All right. Thank you so much.
Thank you.
Thank you.
Okay, we would like to thank Helen Lawhead for joining us on the program tonight to walk us through how the Philadelphia City Council budget works, or the Philadelphia City budget works, and all the little ins and outs. That's a good primer. And she's going to join us again later in the spring to walk us through some of the more nitty-gritty details of the budget. So we're very excited and looking forward to that. So Denise, we know this budget's coming up. We're going to hear about it tomorrow at City Council.
Mhm.
Are there things that you are looking for or keeping an eye on?
Well, there's still a pot of money that the city has to use from the American Rescue Plan funds that they were given at the height of the pandemic, the COVID-19 pandemic. But we're nearing the end of the time period where you can use those funds. So I'm interested in seeing how the city handles that, how Sherelle Parker in her first budget handles that. Because the thing that where entities get in trouble is that they take money that they've gotten from the government that's a one-time thing, and they create new programs with it, not understanding that you have to be able to fund those programs after this money runs out. So it's going to be interesting to see if the city, if Mayor Parker proposes anything new that's directly connected to that money, and if she's thought about how she's going to fund it once that money runs out. I'm also interested in seeing what funding the mayor is going to put toward her plans for Kensington, because we're going to talk a little bit about Kensington later on in the show. But there's been a lot made about increasing the police presence, about changing the attitude toward harm reduction, about housing and different things. And I'm interested in seeing how much money in the budget she's going to put toward that. And the last thing that I'm really interested in seeing, as you know, over the last couple of years, the city has put money aside for anti-violence groups that want to like increase their footprint for programs that they do that work, particularly in the areas of like juvenile shootings and mental health, like trauma-informed counseling and trauma-informed things that will bring down the gun violence rate or further bring down the gun violence rate. I'm interested in seeing how that program gets funded, because depending on who you've talked to over the years, it's either done some really great things or it's given people money who were ill prepared to handle it, despite the fact that the program was supposed to come with someone who helped you through that. If you were like a small mom and pop nonprofit that was suddenly being given $500,000.
Mm-hmm.
So it's going to be interesting to see what the future of that program is in this budget, because the people it's worked for, it's really, really worked. And, rather than get rid of it, I'm interested in seeing if they're just going to work out the kinks.
So specifically relating to Kensington, one of the things I'm really interested in hearing, because we've had all this discussion about harm reduction, harm reduction programs that might be moving out, what's going to replace them. I think it would be a missed opportunity if the mayor did not address that, because there's a lot of people who are really upset about this right now. Now is the time to say, well, no, here's what we're going to do, and here's how we're allocating funds to make sure this works the right way. I'm looking forward to that. I also want to hear about poverty. And this is something that, we talk about often on this program. And while there have been stops and starts over the last few years regarding what's going to be done about poverty, we don't see a lot of that come to fruition. Some of it was pandemic related, and I understand that. But now's the time with a large budget surplus, some momentum, new mayor, new city council to really take a shot at this and really do some useful things here. So I'm looking forward to that. I'm hoping we hear more about that. And again, on the violence prevention, I think that's number one. I think that's the first thing they're going to lead off with. At least they should. So we're going to see how this shakes out. You know, we're going to expect another record budget in terms of the amount of money, $6 billion plus, which makes sense. That's just how it's been working. We're going to hear about the operating budget and the capital budget. We'll see what's in store for that. And, you know, this is going to be an ongoing process. We're not going to have the final picture tomorrow. That will be actually when the budget is ready to go, probably in June. We've been told that a lot of work has already been going into this. So hopefully tomorrow we have a decent idea of where this is going. And then after that, we can all pour through the budget documents and see where we are.
On the Friends Campus site. The good news is that we have the funding to build them. And the better news is that once they're built, they're self-sustaining. So our centers generate revenue for, from insurance reimbursement and some other state and federal means, which means that, once they're built, they will have no effect on property taxes and other, other financial, issues for residents. See about 30,000 patients per year. It's going to be located on or next to the Langdon Street intersection on the boulevard. And there's a septic stop there, and there's plenty of parking, very close to that site. There's going to be designated, in safe drop-off and pickup lanes, handicap parking, and things that'll make it easy, for folks to get to the center. The building has been designed to sort of minimize the impact on the historic Friends Hospital campus.
I'm well aware of the opposing viewpoint, around the traffic issue, the safety issue, but at the end of the day, in medicine, we are weighing the risk versus the benefit ratio. Whatever treatment you choose, whatever medication you choose, the benefit is going to outweigh the risk in order for us to implement that treatment. And here, using the same, analogy, the benefit to the community for generation to come, as we're going to serve across the lifespan, from pediatric to senior to adult medicine. I think in this case, the benefit is really outweigh the risk, which can be safely managed. There is a will, there's a way. That's the saying we all say, and I think that with the support from the community, we can make this plan.
What this translates into is kids not being able to be enrolled in school because they don't have their shots. Kids who might have had, a simple infection that turns a little bit more serious and requires them to go to the hospital. These are real, cause and effect consequence scenarios. And the news is even worse, essentially, at Health Center 10 for adults. And wait times, run up to 12 months. And so, for adults, just like kids, that means untreated disease. So untreated hypertension, untreated diabetes, and all of these things that result in, disability and sometimes death, which is not, not what we're aiming for in any of this, but is the reality for a lot of people who are waiting for healthcare services.
Because it's truly what we've been waiting for too long. I worked here for 30 years. And now that the city is trying to do the best, to do the right thing, now we're going to oppose it. That logic doesn't work, right? We need to change our way of thinking. But I do sympathize.
To say to you, as a city agency, not so much of people who make the case of urgent. First of all, I wanted to start with a positive. I commend you for holding this many meetings to hear the resident. And that is a start. What is lacking, which I'm asking from you, is that all these concerns about traffic, which is concerning the resident and the people who live there. It's not about not in my backyard per se, because this is a healthcare service agency. So it's more about there are some things that we value as a resident living or the community living in this area. We wanted you to address that, so I'm asking you to come back. Once you addressed it, to come back and help provide a solution.
Director of the Pennsylvania Immigrant and Citizenship Coalition. So this is a statewide coalition of over 60 immigrant rights organizations, which honestly about a third of those are here in Philadelphia. I just recently did a survey of my members of what are the most pressing concerns for the communities that they are serving. Overwhelmingly, beyond a pathway to citizenship, healthcare and housing. Number one issues facing the immigrant community: healthcare, housing. For me, this is in my backyard. Like, you literally see my house on the map. Like, I want this. I want this for my daughter, who is 5. I want this for my neighbors, who when I told them, they're like, oh my God, that'd be amazing. I want that for my friends, some of whom are in the room, for their family members who are senior citizens. And I want this because it shouldn't have to take 3 to 5 months for me to have an appointment with my primary caregiver. And I speak English, I'm a US citizen, I have health care, and I'm a pain in the ass. I have a lot of privilege, and it's taking me months and months to get a basic appointment so that I can get antibiotics to get rid of the cough I've had for 2 months. That's a problem, right?
Some of them. You know, one of the main things I hear from my constituents, my neighbors, is healthcare. Need it. I used to attend when I first got married and had kids, and even back then, that's 40 years ago. And even back then, it took forever to get an appointment. So now, 4 years later, and many more people in the city. So this is something that's going to be a wonderful thing for the city of Philadelphia, for the citizens, and I myself am in agreement to it.
My name is Jim Cohen. I'm a second ward. I'm a committee person, that's my ward leader. I just think this traffic thing is a big smoke screen. I look past that site every single day coming and going. Nobody gets it, people watch the lights. We're not going to have 30,000 people going into one healthcare center at a time. It doesn't even make any sense to me, it's just like a smoke screen to keep it out. The other thing is, Flint is a perfect place for this. It's good and parking and, it's accessible, people will go there. I just think we should make up our minds to build this and build it fast.
I'm a dermatologist. I've been practicing in the area for 40 years. I've actually been at all of the health centers in my first 9 years of practice. I'm absolutely in favor of having a health center. There's no question. My concern is the location. There is another alternative. Is it Adams and Rising Sun Avenue?
I am a former council member as well as the ward leader of the 42nd Ward.
Yes.
And I support, nice watch by the way, some very good points. But what's the difference of Roosevelt Boulevard and Adams Avenue and Rising Sun? You're still talking about a congested traffic area. And as far as the green is concerned, there still will be some. That's a huge location. Lastly, you mentioned a huge cost. It's not going to cost you anything. It's going to cost the city of Philadelphia, who was willing to put the money out. And don't think for a minute that the locations that you mentioned doesn't come with expenditures, because they do. Friends Hospital is already functioning as a hospital. What better place to put a clinic than on the grounds of a hospital?
The people of the Northeast for years have been, looked upon as if they have everything. But this is not true. This is a healthcare disparity that's happening in the Northeast. And every single health center advisory council needs to be supportive of this. Health Center Fund Advisory Council, we're on board with you. We want you to have this because it means that we can get a sooner appointment. But I applaud the city of Philadelphia. Not only is the Department of Health in the city saying We want to build new health centers, 2 of them, not 1, 2 of them, and we want to build them in an area that is a healthcare desert in terms of public health.
I'm so grateful to everyone that's involved in trying to make this a reality. Like I hear that there are some of the, not in my backyard in terms of traffic. So grateful to have this potentially in my backyard. This is so desperately needed. I think the way you described it as a public health desert is, honestly, I can't think of a better way to word it myself. But I know for myself, living in Northeast Philadelphia was struggling. Like bladder infection, and then it's like started to get the symptoms of a kidney infection. That's not something where it would have been safe for me to break safety net. Any possible downsides are so outweighed by the fact that it will literally save lives. It will be improving care for people with chronic conditions that you're going to have both kids and adults that can get necessary vaccinations, which with the 15 concurrent public health crises we have going on now, we can all agree is very important for the health of those individuals and the community.
For this discussion, thank you for your input. We hope to gather all of the information, as I mentioned at the beginning, and come back to all 4 neighborhoods with what we have found and how we will move forward. We need to understand that we are all neighbors, right? We need to be respectful of each other. We know that we're not always going to agree, and that's okay, right? That's what makes Philadelphia special, right? Is that we're able to live in neighborhoods, in communities, and that there are times that we are all going to walk in the same direction, and there are times that we are not, but we all have to be able to live and respect one another. And so I'm really hopeful with all of the questions that I've heard in the last 3 or 4 meetings. I'm excited about the possibilities of moving the project forward. And we hope to be able to send all of your question responses back, hopefully very soon, so that we can get so that we can continue moving forward in whatever direction it is that we see fit. So thank you so much. My office is always available to you all. I'm in City Hall in 49484. We are ready to respond to questions that you may have after this meeting, or if you talk to your neighbors about things that you've heard at any of these community meetings and they have questions, please feel free to reach out to us, and we'll be sure to communicate them to the health department and add those questions to the question response sheet that we are creating. All right, thank you.
All right, we'd like to thank Lance Haber for that piece. And now we are going to bring you a story with our new homeowner correspondent, Allison Beck. All right, Allison Beck, thank you so much for joining us.
Thank you, Larry. I'm excited to be here.
All right, so you've done some great work about what's going on up in Kensington. Can you tell us, let's start with what's going on with Savage Sisters and Prevention Point. I know you've been doing a lot on that. Tell us a little bit about that.
Yeah, so it all really started at the end of January when Savage Sisters told me that they had finally gotten a meeting with Ketsi Lozada that they've been trying to get since, I want to say, the end of November, just to talk about their place in City Council and the Mayor's office's new strategy when it comes to the opioid epidemic in Kensington, because they knew it was going to be a little more aggressive, right? And what they told me that they were looking for in that meeting was really just to be a part of the conversation about what exactly was going to happen. And you know, they got to the meeting with Councilmember Lozada, and she basically told them that she didn't like what they do, she didn't like them, and that she was going to get them shut down. And that was basically how the meeting went, according to them. And that kind of carries out into what she herself has said about the meeting. And you know, that news broke to the press pretty soon after that, and things kind of snowballed into Prevention Point being next, and a lot of kind of public conversation about what that strategy is actually going to look like.
So, what was it about Savage Sisters and Prevention Point that Councilmember Lozada objected to?
I honestly am not really sure, because she says a lot of different things about kind of the problems that she sees, specifically with Savage Sisters. I know that she's mentioned to the hall monitor that they have been a nuisance business or storefront. I don't know what you would call that, but that they've gotten complaints from police, and that they haven't cooperated. I did look into 311 complaints from them, because she did mention it was a lot of them like letting people use in front of their storefront. And over the past, I think, 2 years, there was one for their address. Which kind of raises some questions for me. I know not everybody calls 311, because the efficacy of that is not always the best in Kensington, but you know, she also takes issue with this idea that harm reduction is enabling to drug users, when, you know, Savage Sisters is really just offering people bathrooms and showers. And then Prevention Point, I know you spoke with her, so you might be able to speak to that too, of her issues with Prevention Point, and that their overcapacity with their program, which, you know, leads her to think that they should be stopped from doing that. But it's really the kind of dual idea of they're a nuisance and they're encouraging people to use drugs.
And you know, yesterday the Committee on Human Services had a hearing with two pieces of legislation. One was the impermissible camping bill, which would require reporting from the managing director's office, and the opioid antidote bill, which would also require the managing director to compile a report about people who have received the antidote multiple times. Both bills were held. But one of the things that I thought was interesting in that hearing, and I don't recall Councilmember Lozada saying this before, but certain organizations that are, in her words, you know, and I'm not putting words in her mouth, I'm paraphrasing, but that are doing harm reduction might not be doing it well, and might be spending a lot of city money on things that aren't being beneficial. I think was the way what she was trying to say. I had not heard her mention that before that I recall. It's possible she did, I just don't remember it. But when we look at Prevention Point in particular, it was really interesting. When we spoke to her a couple weeks ago about it, she said that basically they had exceeded their mandate by an order of magnitude so great that they were probably overwhelmed. But on the other hand, I looked at that and say, well, doesn't that mean that's a reason for them to remain, or to find another way, right? Isn't
Exactly.
that what the point was? So when we look at Savage Sisters now, what are their recourses? Because my understanding is their lease has been denied. So what are they looking to do now, and how are they trying to keep this going?
Yeah, I know they were considering fighting the lease. They did get a petition with a lot of signatures to send to the landlord, but they seem pretty firm that this was their final decision, and they want to move in a new direction. I think their current plan is to get a van, and put a bathroom and a shower, and you know, a mini storefront almost, to help folks. That's as far as I know about their future plans. But you know, there isn't a lot of recourse for them as far as I can see.
Yeah, and especially with the council member really being in charge of zoning, there are all different kinds of things she could do to make it difficult. So last week, people went to City Hall and protested these actions and other actions. Well, can you tell us a little bit about that?
Yeah. So I think the protest started at 8 o'clock. Went until 10:30. And it was just a bunch of people circling City Hall with a lot of handmade signs in support of harm reduction. It was a lot of people who have lost folks to overdose, or know people who are using right now, and they're really just saying this policy is going to kill my family and my friends, and I don't want this. And there was this really interesting moment where everybody kind of formed a circle in that center plaza area of City Hall. And Sarah Laurel, who's the founder and executive director of the organization, talked a lot about how city council isn't listening to this group of people, and they didn't talk to this group of people about these plans, and they just want to make their voices heard.
All right, I'd like to bring Denise Clay Murray here on Philadelphia Hall Monitor.
Thank you. And thank you for joining us, Allison. We really appreciate it.
Hi, Denise. Congratulations on your pen and pencil award.
Well, thank you. I appreciate that. Thank you so much. I guess, and this is something that I'm just going to come out. I have people who have been addicted to drugs in my family, and I've seen what the process of getting them into treatment has been like. And I guess the question I have is, when you talk to the council members, they're telling you, well, we're doing this based on what we're hearing from the community. And yet you're hearing from the folks who are trying to do harm reduction that they're not talking to them. Why has they talked to any members of the community itself that have the people in the harm reduction space talk to people in the community and try to explain to them that we're trying to make it so people don't drop dead on your porch?
Yeah. I know Savage Sisters specifically had done a door-to-door survey about their services right after kind of news broke that their lease was going to be terminated, and it was overwhelmingly positive. And this is a survey conducted by Savage Sisters about Savage Sisters, so grain of salt, but it was overwhelmingly positive. Just people saying, yes, I want this to continue. I think it's important that people have bathrooms and showers and just really a human to connect with who can kind of advocate for them, to say, hey, like, you deserve better than this. I don't know exactly who the council members have been talking to. I can totally understand the perspective of folks living in Kensington saying, I just want this to be over, and nothing has worked so far. But that kind of lack of a diverse perspective, I think, is concerning to me.
Now, you said that there were people protesting outside of City Council last Thursday regarding the mayor's perspective on harm reduction. Has anyone, gotten a meeting with the mayor? Because I can't help but think that a lot of this attitude toward harm reduction in Kensington is a top-down thing and not necessarily organic to just council.
I don't know if anybody has gotten a meeting with the mayor. I haven't heard about anything. And I know, like I said before, Savage Sisters have been trying to get a meeting with Councilmember Lozada since November to talk about the policy. So I wouldn't be surprised if it just isn't happening.
Okay. Now, what drew you to this story? Because I know with me and Larry, the stuff that draws us to things is like we're geeks and we're in City Hall all day, and that's what we do. But what drew you to this particular story? And what have you learned from covering it that you didn't know before about the politics of harm reduction?
Yeah. So it's kind of a weird, not a weird way, but a sort of a roundabout way to come to a story. I am making a podcast about the point in time count for one of my other jobs. And somebody in my volunteer group works for a harm reduction organization in Kensington. And we just kind of connected and we talked a bunch. And she said, hey, if you ever want to come to Kensington and get a tour almost from my perspective as somebody who works here, shoot me a text. And I did that. And this was right kind of as this news was breaking that city council and the mayor were going to, start reducing harm reduction services, including the one that she works at. And just the way that she talked about kind of her fears for the people that she helps every day, talks to every day, and really that anger at the fact that this is going to go away and I have no say in it, was really what put me onto the story, and kind of talking to Larry about, hey, how does in that same geeky way, really, about how does the machine work? Like, what are the actual pieces of this that are making this happen? And do they look like they will succeed? Are they evidence based? Where is this coming from? So that's what really drew me to the story. In terms of what I've learned, I think I definitely learned a lot about balancing perspectives, because again, like I hear, Jim Harity's perspective about how these people need to go to treatment. They don't deserve to, be sleeping on the streets all the time. But I can also kind of look at the facts that we have here about, how these things don't work generally with policing. The number of rehab beds we have is up for question. I did a open records request the other day to ask about that, but they haven't gotten back to me yet. But yeah, really just taking away kind of the need to really dig into policies, which is what we do here, and really, advocate for the people who aren't being heard in these processes.
Because you bring up something that I've heard more than once, and when I listen to hearings or listen to testimony, or we've done interviews here on Hall Monitor about this, and that is the perception that you can put somebody who is addicted in any bed, a homeless shelter bed, a treatment bed, that you can just put them in any bed just so you get them off the street. And what that doesn't take into consideration is that A, homeless shelters are not set up to treat addiction. B, most people don't go to homeless shelters because they don't think they're safe. And C, you only get so much time in a homeless shelter. What happens when this person leaves? And another thing, and I kind of wanted to end, my last question to you to be this. Back in the 90s, when I first started in journalism, my first assignment was covering HIV and AIDS in the Black community. And one of the ways that it was predominantly being translated, transmissioned in that particular community, particularly when you were talking about men and women who were also in addiction, was through heterosexual sex between people who shared needles. Has anyone said, I know that the Savage Sisters have probably talked to folks about this, but have you heard in any of your reporting, has anyone even brought up the prospect of the fact that this could cause the HIV rates in Philadelphia to skyrocket again?
Everybody's talking about it. That's one of the main, I think, talking points in favor of harm reduction is there was an article, I want to say in the Inquirer, that mentioned a study that kind of showed that the projected HIV rates in Kensington were reduced by, and I'm paraphrasing from memory, I think 2/3, because of these needle exchanges, which really speaks to, what could happen if they go away. I think the other thing that you mentioned, that is worth noting too, kind of with the health concerns here, is that not only, can you not put folks in just any bed, they need 6-month rehab, they need a facility that is equipped to handle the drugs that they're on, because they're not just detoxing from alcohol or even cocaine or something else. They're detoxing from a cocktail of drugs, including xylazine, which is that horse tranquilizer that is being cut into the supply. And the thing that I learned about xylazine actually is that the detox for that is actually more similar to alcohol in that you can have seizures and heart attacks if you don't detox properly. So that really also raised a concern for me in terms of city council's approach to getting people into rehab or prison is, what happens to folks as they detox if it's something, the facilities aren't prepared for. So that public health angle is definitely top of mind for folks in that area.
Okay, thank you, Allison. We really appreciate it. And I'm going to give you back to Larry McGlynn, and you're listening to Hall Monitor on WPPN 106.5.
All right, thank you, Denise. And Allison, before we let you go, what comes next with this story? What are you keeping an eye on?
I'm definitely keeping an eye on those bills as they kind of progress through council. I know you said that it recently was paused or stalled, or I forget, the word is escaping me, but held. Thank you. But I'm also looking at the protests and what people are saying and that kind of public support and who's saying what is definitely of interest to me. I also am going to keep following that public health perspective in particular when it comes to how many rehab facilities does the city actually have contracts with. What are the specifics of their plan for this triage center, and what's going to happen as we hit April and policing starts to increase, but we don't really have a concrete plan for where to put folks. So lots of things to follow. So I'll be back.
All right. Well, Allison Beck, Hall Monitor correspondent. Thank you so much for joining us.
Thank you. It's great to be here.
All right. We would like to thank all our guests this evening. Our own Lance Haver for providing us that important report from the public meeting for the Community Health Center. Allison Beck for joining us to talk about Kensington, and Chief Financial Officer Helen Lawhead walking us through the budget. We'll be back next week on Hall Monitor.